Welcome. I'm Jan Marini, the founder of Jan Marini Skin Research. I am here with Sandra. Sandra's here for her consultation. Now, Sandra is actually the sister of one of our sales executives, Jenny Smith. Jenny, thank you so much for referring your sister, Sandra. So, I'm going to ask you a few questions.
Yes.
If there was anything you could change or improve about your skin, what would it be?
Complexion, just a smooth complexion.
Okay, so what do you mean by smooth complexion?
I have large pores, history of acne that I still get till this day, and it's just bumpy and grainy even with makeup on after moisturizing. It's just not smooth.
Okay. Anything else you want to change or improve?
Acne.
Okay,
That
so
goes
yeah.
hand in hand.
Acne. Anything else? Acne.
Acne.
What else? Acne.
I have like kind of deep set eyes, a little darkness,
Dark circles,
dark
okay.
circles, and these little bumps. I don't know what they're called, like little white
Okay.
ones, Amelia, I think. Just overall.
Okay. Do you think your skin is more normal, combination, dry? How do you categorize it?
I would say combination. Like after I wash it, it's dry for a couple hours, and then throughout the day, it's completely oily.
Okay. When you say it's completely oily, are you oily everywhere or just in the T-zone?
Mainly the T-zone, but I do get oil everywhere, but mainly T-zone. Forehead,
And
chin.
is it noticeable? Do you have to blot? Do you feel like you have to blot during the day?
Yeah, or I'll just grab my makeup brush and kind of go over it.
With a little powder or something.
Mm-hmm.
But the cheeks, do they tend to get oily but not as oily?
Yeah.
Do your cheek ever feel dry or more normal, or is it pretty much always kind of on the oily side?
I think after I wash, it's dry for a couple hours. If I do get a blemish and I put something on it, the next day it's dry, or the next few days it's dry, but usually oily.
Okay. Have you ever been a smoker?
No.
Sunbather?
Never. I never did that. I mean, I've been in the sun, but I don't.
Yeah, but incidental sun exposure, but not a sunbather.
Yeah.
Okay. And when you said you had acne as a teenager, and by the way, back at our other corporate office, which is about a mile and a half or so from here, I remember that Sandra came in as a case study as a teenager. And so tell me, when you had acne as a teenager, and you mentioned that you've been on Accutane, so how old were you when you went on Accutane?
I was, I think, a sophomore in high school, so like 14, 15, and I didn't have like severe cystic acne. I just had a lot of the little white bumps everywhere, and I got a lot of like the under the chin.
So papules and pustules, like you get red bumps, sometimes they turn into pustules, and you get a lot of just bumps under the skin.
Yeah, it looked like a rash almost all the time. And they alluded it to maybe sports with sweating, because I played basketball throughout high school, but I always washed right after. Yeah, I did Accutane.
Yeah, that's kind of close comedal acne. It's just a type of acne. So, actually, acne is a term that describes a process. You can have a clogged pore, and that's actually a form of acne. You can have blackheads as a form of acne. A lot of people say, oh, I don't have acne, I don't break out. Well, or I just break out once in a while, I don't have acne. Any breakout is an acne breakout. It's just a matter of whether you have them frequently, infrequently, whether you have them consistently, whether it's very mild, or whether it's more severe. So, and the Accutane helped?
It helped, but it didn't deal with obviously the pore size, and and I still got it after. So it helped while I was taking it, but it came right back.
So it got really clear while you were taking it. And
but I was dry.
Do you remember how many months you were on it? 6 months?
I think it was 6 months. I think we did 2 sessions. It's been so long ago. So we did it 2 rounds, and each time it worked, but they did the second round because the first time.
Did you go on a higher dose the second time?
Yes.
And so the first time, do you remember how many milligrams you took? Say a yellow tablet?
Yes. It's yellow.
So 20 in the morning, 20, you took one in the morning, one at night, okay. And then you went to a higher dose.
I think they upped it the second time, but it made me not feel so good. So
When you
we
say
stopped.
and so when you said it did make you feel good, what do you mean?
I got, I just felt like a cloud was over my head. I just was always down. Yeah, it was one of the side effects, I guess. I was chapped everywhere, just my lips were blistering. Just quality of life went down, and it wasn't worth it to me at that point through that way, so we stopped.
And the second time around, you cleared, and then was your acne better afterwards than the first time?
Yeah, it was better. It was more like it would only come around period times, like hormonal.
Okay.
So it was better.
Okay, so it's more consistent.
Yeah. Stress induced as well, we've noticed, because around my wedding planning, it was terrible. And my skin was terrible. I was like, I'm not getting married like this.
Well, one of the things that happens with stress is stress can cause certain hormonal activities and more, it can cause more testosterone. Now, as an adult, have you ever done anything like using spironolactone or taking spironolactone?
No, and I brought it up to my physician, and they told me that I go to Kaiser, and it wasn't a plan of action that they follow there.
Kaiser does it because unless you have something that is specifically indicated, spironolactone is actually a diuretic, and for Kaiser, unless it's specifically indicated, like, okay, you have high blood pressure, you have congestive heart failure, if it's so they don't do anything that's off-label. What spironolactone does, it's an unusual diuretic in that it's for acne, certain types of acne. It's used at a very low dose. So instead of taking 500 or 1,000 milligrams a day, you might take 50 or 150, between 50 and 150 milligrams a day. And what it does is it blocks the interaction of certain hormones that you have in your, certain enzymes that you have in your follicle, which are collectively known as 5A reductase, and the possibility of some free testosterone or testosterone sensitivity outside the follicle. Now, it's estimated that as much as 90 to 95% of adult women that have acne, which is an epidemic today among women in their 20s, 30s, 40s, and beyond, that it could be this, and it probably is a testosterone sensitivity. So what it does is it puts a wall up, because when these two come together, the sensitivity and the enzymes, they produce dihydrotestosterone. And it's generally, women have a problem with the jawline, the chin area. It's very stubborn. You can go on Accutane, gets better, skin looks great, you go off of it, within a year it's kind of back. And so this is one of the options that people can discuss with their doctors. Now, typically we can get people clear with things like benzoyl peroxide and some other things that we're going to talk about. Okay. So let's talk about what you use currently. What do you wash with in the morning?
I use just a general cleanser, a Mary Kay. It's like a light cleanser, gentle.
Okay, is it like a gel?
Yeah, it's a gel.
Okay. And as I always say, if a cleanser is a gel, it's usually all skin types, or maybe even combination or on the oilier side. If it's a lotion, it's more normal to dry, and if it's something that's a cream, it's usually for dry skin. So what do you do after you cleanse?
After I cleanse, in the morning, right? I then put sunscreen on, and I use the Marini sunscreen.
Oh, okay. The SPF 33?
Yes.
Okay.
The tinted one.
The tinted one.
Yes.
You know,
I think it's the physical.
Oh, the physical.
Actually,
okay,
sorry.
The SPF 45.
Yeah.
It's got a little bit of what the SPF 45 is, a physical block. And the reason she called it a tinted sunscreen is because it has a little bit of a universal tint to it, so that it doesn't look white on the skin.
I love it.
And it virtually blends with everyone. And people love it because it kind of does even out your skin tone, and it makes it look like almost like a little bit like a tinted moisturizer. But it also has the microscopic, or I should say the oil capture system in it, so that it helps to keep your skin from feeling as oily. Okay, great. And then anything that you do after that, foundation, anything like that?
Yes, I just use a mineral powder
Okay.
foundation, and it has SPF
Bare
in it.
minerals?
Yes, Bare
Okay.
Minerals has SPF, and then my makeup, my blush. And I've been using a highlighter recently. And
Okay. Now, do you use the same cleanser at night?
yes, I use the same one at night. I do use a toner.
Okay. And is there anything in the toner that you're aware of? Like, does it have salicylic acid or anything like that, or is it just a toner?
It's just a regular toner.
Okay.
I was actually reading last night. It doesn't have salicylic acid in it, but sometimes I use makeup wipes if I'm
Okay.
lazy, and I would rather do that than not wash. And they do have salicylic acid in those.
Do you know who makes them?
Neutrogena, I
Okay.
think. And then I just put a moisturizer after that.
And moisturizer.
It's a Mary Kay one.
Okay. And is there anything in particular in that stands out? Is it a cream?
It's a cream.
Okay.
It's like a white, creamy, yeah. And then there's an eye cream. It's like an eye gel. Sometimes if there's puffiness, I'll use. I'm not sleeping enough.
And do you do anything if you do have a breakout? Do you do anything in particular for it? Is anything different?
Yeah, so Mary Kay also has the benzoyl peroxide, so sometimes I'll spot treat it. But then I don't know if I put too much, and I end up getting really dry the next few days. But I think it's not 10%, it's less than that.
Okay. And do you ever use a mask or scrub or anything like that?
Oh yeah, so there's this, I don't know if it's bad, you're gonna yell at me. It's this mask that my friend told me about. It's kind of like a clay mask, and it dries on, and then you wash it off.
Do you remember the brand?
It's a natural, it's called the Native American clay mask.
And
you could get it anywhere over the counter or Amazon. So you have to mix it with apple cider vinegar. So I don't know what that does, but it makes me look smooth sometimes.
So do you feel like your skin is any better after that?
I do feel like overall like shinier, more dewy complexion for a day.
And how often do you do that?
Like once every 2 weeks.
Okay.
And that's all I do.
Okay. So let's talk about this. So one of the areas where I want to start off at is talking about benzoyl peroxide. Benzoyl peroxide is incredibly effective if you use it right. So one of the issues with acne is that you have P. acne bacteria, and I'll get into this in just a second. But benzoyl peroxide, benzoyl forces peroxide in the follicle, releases oxygen, and P. acne bacteria can't live in oxygen. Kills it better than anything we've ever seen. It works better for most people even than oral antibiotics. And this is a statement by the American Academy of Dermatology. If it works for you once, it works for you forever if it's the right percentage. It's the most effective antibacterial agent ever invented. But the misconception is that people oftentimes put it on after they have a breakout. Now, the breakout is at the end of the process. So it really doesn't do anything for it. It might dry it out. And so you're kind of thinking, oh, it's going away faster because your skin kind of peels. But benzoyl peroxide is a preventative. So you have to use it every single day, every single night. As a matter of fact, I'm a 2-time Accutane failure. I never break out. I use benzoyl peroxide every single night on areas of my face or an area where I know that I would tend to break out. Now, luckily, it's down to a very small area. And so what I do is I put it on to prevent it, and I never break out. The other common misconception, or I shouldn't say it's a misconception, I think the reason why people don't use benzoyl peroxide consistently is because it's looked at as a teenage medication, and they perceive it to be drying. And they're not wrong. But what we're going to talk about today is a different type of benzoyl peroxide. This benzoyl peroxide it's a much newer version, and you're not going to find this typically over the counter. But it's a benzoyl peroxide that instead of being 60 microns, which is the normal size, the normal weight of benzoyl peroxide, it is 5 microns. It's very small particle size, and it penetrates very rapidly, and it kind of bypasses the surface of the skin. And this was actually tested in Alberta, Canada, in weather 20 degrees below zero. The patient's skin was more hydrated after the study than before the study. It was tested by Dr. Jaggi Rao, who is board certified in dermatology in Canada and in the US. He's also the head of the dermatology residency program at University of Alberta. He is the CEO and founder of the acne clinics of Canada. He treats more acne than virtually anybody else in Canada. And so the clearing is also just superb. What we're the other thing that I want to kind of go back and talk a little bit about the acne process, and we may have talked about this way back when, but at any rate, so what happens with virtually any type of acne, and it's just a matter whether you have it more severe or whether you have it once in a while, is that we have the outside of your skin, which is a stratum corneum, is a dead layer, and you shed cells constantly. You shed about 500 million cells a day, but you're just not aware of it because they're microscopic cells. Inside your follicle, which is about as big around as the diameter of a hair, and I always think that of follicles as being these huge caverns, and thinking about it, gee, it's only as big as around as the diameter of a hair, but inside you are shedding constantly dead cells into the follicle. One of the reasons you produce oil, which doesn't keep you younger, by the way, but one of the reasons you produce it is because it pushes the cells to the surface. They sit there and they fall off. That's the normal process. Now, individuals that have acne, for whatever reason, could be genetic. We haven't discovered the acne gene, but generally it tends to run in families. The cells stick together. That's the beginning of the acne process, and that very beginning point is what is known as a microcomedone. So microcomedone is a microscopic clump of these cells sticking together, and you could have absolutely perfect skin at that point, perfect looking on the surface. You could be 10 years old. Microcomedones can sit dormant for days, weeks, months, or longer. Sometimes they just sit there and they don't even progress. But what happens when they do progress is the cells continue to stick together, and it traps P. acne bacteria in the follicle, also traps oil. Now, P. acne bacteria is harmless, so everybody has it. But when it's trapped in the follicle and there's less oxygen, the bacteria flourishes, and what it does is it eats the oil. And as it eats the oil, it excretes a fatty acid byproduct. The byproduct wears the follicle walls down. If everything stayed in your follicle, you'd never have any lesion on the outside of your skin. But the follicle has to somehow expel this material. What happens is this fatty acid byproduct wears the follicle walls down to the point where you get what's known as a leak. A leak is where you're going to have a papule. Maybe it turns into a pustule. If you have what is known as a rupture, this is when you get the more nodules, the more cystic lesions. If you have a blowout, blowout of the follicle, you're definitely going to get a cyst. It's an inflammatory disorder. And so generally with the more superficial lesions, you don't get scars, meaning a loss of tissue or a divot. If you have the really bad cystic acne, what it does is it actually, as the inflammation makes its way to the surface, it's so deep it destroys collagen. So you almost always get scarring. And there's something called closed comedonal acne, where it's just very bumpy on the surface, but it's still a form of acne. And sometimes that can be very difficult to address. So what we have to do is we have to introduce something in the follicle, number one, that keeps the cells from sticking together. And that helps to interrupt the acne process. Then what we need to do is we also need to introduce something in the follicle that keeps the P. acne bacteria from colonizing. So we can't kill it permanently. It's not one of those things where you can just say, okay, I'm going to kill it off and it's never going to come back. We have to do something that's called bacteria static. And that means that if you do this continuously, it keeps them at a level where there are not enough of them to eat all this oil and excrete the fatty acid byproduct. And so we can get clearing. There's some other things that we can do, and a lot of these things that we do also make a huge difference in the appearance of the follicle size. Because you have large follicles or a tendency to large follicles for 3 reasons. One is heredity. Maybe you just inherit skin that's not as refined. But the second thing is that if you have retentive material in your follicle, it causes the follicle to dilate. Now, follicles are not trap doors. You can't open and close them like trap doors. When you get your face steamed and I'm opening your follicles. No, it doesn't work that way. But if you can get rid of the retentive material, reduce it, the follicle relaxes. The third thing that happens, and this has to do with aging. Now, most of the damage that you're going to see throughout your life when you look in the mirror and at some point you go, oh, gee, I'm getting fine lines or my skin is changing. Most of that is sun exposure. And even if it's cumulative sun exposure, great that you weren't a sunbather. But we all have cumulative sun exposure. And so most of that damage that you see happened before the age of 10, and about 50% of it is programmed into your DNA at least before the age of 50. So your dermis is about 80% collagen, and as the collagen level goes down, as it becomes compromised due to sun exposure, collagen acts like a girdle around your pores. And so the more collagen you have, and the firmer your skin is, and the more volumized it is, it keeps those follicles really tight. So sometimes even when people don't have acne and their skin is quite clear, as they get older, they're like, my follicles are getting larger. So we want to do things to prevent that. And a lot of things we're going to do also is going to make a huge difference in how your skin's going to look 10 years from now. Okay? So that's what we're going to focus on. And plus the dark circles. Now, dark circles are something you inherit because you inherit how close the blood vessels are to the surface of your skin. So individuals that have dark circles typically have blood vessels that are closer to the surface. Now, there's also things that have to do with ethnicity. So if you have more of an olive or darker complexion, some people have more pigment in that area. But as you get older, dark circles typically get worse because the skin underneath the eyes tends to thin, the blood vessels are more noticeable, plus they're influenced by all kinds of things. Now, if you ever notice that your dark circles are worse if you have a cold, worse if you don't get enough sleep, if you're having allergies, because what happens is the circulation in that area slows down, and so the blood vessels get engorged, and now they're even more noticeable. There are things we can do for the appearance of that can really make a difference, and can also make a difference in the texture of that area. Yeah. These people that get lines over here, those are crow's feet. That has to do with dynamic muscle movement. That's Botox. But we can make a big difference, and you're not there yet, so we don't have to worry about that. So what I'm going to do today, and I'm thinking about this for a second. I'm just thinking. I'm not ignoring you. Do you feel like when you're using your Mary Kay gel cleanser, do you feel like that it gets your skin clean? When I say clean skin really doesn't have anything to do with acne. You can have, people think, oh, I get acne because my skin is dirty. That's not it. But when you have a tendency to oily skin, you want your skin to feel like the oil is gone and that it feels really nice and clean without feeling like you've stripped the oil. Okay, do you feel like this gets your skin really clean, or tell me the sense that you get with this cleanser?
I notice at night that when I wash with the cleanser, then I do like a toner on a cotton ball, I still see like the makeup and it's not completely gone, so I don't feel like it's completely getting everything off. I don't know if it needs something more creamy. but I don't feel like it's a complete cleansing. It's more of just a gentle.
Okay.
But I feel like I could do more in that sense.
So one of the things that, and it's not to say that this isn't a good cleanser, but even if you have a really good cleanser, they don't get into your follicle. They only clean the surface of the skin. The only thing that can really get into the follicle in a cleanser is glycolic acid. And that's a good thing. One of the reasons why a glycolic acid cleanser is really good, whether you have acne or not, is it goes into the follicle and can help to break down follicular retention. And so we definitely want to have her on a glycolic cleanser, but I'm just trying to think, do we want you on the regular one? Now, have you ever used our glycolic cleansers
I
before?
did a long time ago.
Do you remember if we had you on the oily skin cleansing gel? Or if we had you on, was it a gel or was it more creamy?
It was more creamy. It was the white cream.
Did you feel like that was enough for you, being that you were oily, or did you feel like you needed more?
I think that was a good amount. It's hard to say because it was so long ago. I remember when I was using it, I felt like it was a good cleanse.
Okay.
It didn't completely strip the oil, but it was. I felt clean.
Okay.
I don't know if that helps you. I'm sorry.
Yeah, that does help me. Thank you. Again, I'm still thinking. I think what we're going to do today, I'm kind of going to, I believe, piecemeal your system a little bit. I'm going to start you off on our bioglycolic facial cleanser. Now, the bioglycolic facial cleanser is the one that's in the system. So I'm going to have you do the bioglycolic facial cleanser. And I'm going to still have you using the SPF 45 sunscreen because you like that and there's no reason why you can't. And like I said, it's got a little bit of a tint to it so that when you put it on, it doesn't really look like you're wearing a foundation, but it kind of evens your skin out. And it's amazingly because it is a physical sunscreen, so it helps to kind of keep the skin from looking white. So a lot of people really love that. And then I'm going to have you using Duality.
I heard great things about that.
Pardon?
I heard great things about that one.
So Duality is really kind of a game changer because this is a product that is for individuals. I mean, teenagers can use it, but this is primarily developed for adults that have acne, which again is an epidemic among women in their 20s, 30s, 40s, and beyond. And so many times there's this dichotomy of, do I go out and do I treat my acne? And like you said, when you treat your acne, then you feel like you're dry for several days. So then you don't treat your acne, or you only treat it when you break out. Or on the other hand, do I use products that, people brag about that are anti-aging products or whatever, and then I worry that I'm going to break out. So what do? And in the US, we spend more money on non-prescription acne products than we do prescription acne products. So people are constantly looking for solutions, and you just don't know, where do I turn? And Duality is something that actually is de-ages the appearance of skin, but it addresses acne. And for years I had physicians say to me, Jan, if you could take the two gold standards, which is benzoyl peroxide and retinol, because they're both used for acne, and put them together, fantastic. Well, you can't put them in the same formula because they render each other inactive. So what this is a dual chamber product where it's one container, but there's a dual chamber. So when you pump it out, you just mix it in your hand and you put it on, and you're getting the retinol, the benzoyl peroxide. Now, the benzoyl peroxide is a benzoyl peroxide that I think I mentioned to you already. I think we talked about that, which is it doesn't dry the skin out. So it's very, very different. The other chamber, which has the retinol, is going to make a difference not only in the breakouts, but it's going to make a difference in the appearance of your skin in terms of the appearance of the follicles, the appearance of the smoothness, just making the skin kind of have that more There's nothing, people want their skin to look luminous. They just don't want it to look oily. They want it to glow,
like
but
yours.
they don't want it to look shiny. They want it to have this really refined texture. So that's exactly what we kind of want to go for. And so this product I think is going to make a huge difference with regard to that. It also has something in it that gets rid of discoloration about 300 times faster.
Nice.
And it's got a number of other ingredients that are going to be very, very helpful for your skin. Now, in addition, I'm also going to have you using the BioClear. And the BioClear is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for acne. When you put it together with the glycolic and the salicylic, this is what helps to go after follicular retention. It just really helps to make the skin look so much smoother, and it can help with the appearance of breakouts, and it just makes the skin look younger, all of that, the texture and everything. So I think that's where we're going to start you. Now, I also am going to have you using something called Cleanzyme and Skinzyme, which is a proteolytic enzyme. The fact that you're using the clay masks, there's nothing wrong with that. What clay masks do is they tend to absorb kind of oil out of the follicle. They're not like vacuum cleaners. They don't really absorb follicular retention, but they make the skin look softer initially, because also when you take the mask off, it attaches itself to that dead layer of skin. So in a sense, you do some exfoliation and it just feels softer and smoother. With Cleanzyme and Skinzyme, that is a proteolytic enzyme. It comes from green papaya, and it has the ability to digest dead and diseased tissue, but it can't hurt normal living tissue. So a lot of times when we exfoliate or use products to get rid of dead skin, those products don't know the difference between the living skin and the dead skin. It causes inflammation or can aggravate certain conditions. So in this case, you really, it is kind of an intelligent exfoliator. And it just leaves the skin looking like glass. So I think it's another one that you're going to really like in terms of trying to reach that goal of making the skin just look a lot more refined and the texture of the skin. So I think this is a good starting point. And what we're going to do is we're going to continue to monitor you and work with you. My assistant's going to check back with you in about 4 days.
Okay.
Because 4 days is the average time when people say, oh, gee, it's not working, it is working, I don't know if I like it, I don't know if I was supposed to sting, I don't know this, that, the other. And average person has over $600 in product in her bathroom that she doesn't use. So it's really good. This is why we want to monitor people. Plus, if we need to adjust your program at some point, if we need to modify it. And as her skin clears, there may be things we want to add into her program. There may be more resurfacing things that we can do. But I'll personally check back with you in about 2 weeks. Okay. And then we'll continue to check back with you. Okay. And as your skin continues to improve, we can actually take it to even a greater level of clearing and kind of getting toward your goals. Okay? That sound exciting?
Sounds great. I'm excited. Can't
Yeah.
wait.
Well, I'm excited to see how you do. Because this is something where I think everybody deserves to have clear skin. And I have to tell you, I have never had anybody say, well, Jan, I don't want clear skin. I want to break out.
Exactly.
So everybody wants clear skin. Everybody wants skin that looks healthy. So that's what we're going to try and accomplish for you.
I'm very hopeful.
Well, thank you. It's really been a pleasure. So goodbye for now, and please subscribe. Bye.